Tonight's subject, the COVID-19 vaccine, is on the forefront of everyone's mind, and it is fitting that the program be presented by Montefiore St. Luke's Cornwall, a leader of healthcare excellence in our community. Thank you to our audience for taking the time to submit questions in advance of the program. The chat room is open for other questions you may have, and a contact email will be supplied to you if you still have questions once the program is over. Our presenters are no stranger to the healthcare world, and I am pleased to introduce Dan Muon, President and Chief Operating Officer at Montefiore St. Luke's Cornwall. He brings over 25 years of both clinical and leadership experience to the hospital. He has been instrumental in their transformation in recent years. Most recently, Mr. Muon has been leading the charge on the COVID-19 vaccination program. In just several weeks, Montefiore St. Luke's Cornwall has vaccinated hundreds of individuals, including employees and eligible frontline workers. Dr. Evan Cohn, want to wave for us? Perfect. Medical Director and Chairman of Emergency Services, is an emergency medicine physician serving the New York City area. Dr. Cohn is board certified by the American Board of Emergency Medicine. He received his bachelor's degree of science from Syracuse University in 2003 and graduated from the State University of New York Upstate Medical Center in 2007. He completed his residency in emergency medicine at Cooper University Hospital in Camden, New Jersey in 2010, and has been in practice for 12 years. We also have at the table Kate Dabrowski, Vice President of Marketing, Public and Community Relations. And now I have the privilege of turning the program over to you. Thank you.
Thanks.
Thank you so much for that introduction, Brenda. And as Brenda mentioned, we will be addressing questions that many of you submitted prior to tonight's seminar at the conclusion of the PowerPoint presentation. If you think of any questions during the presentation that you would like to add, you can utilize the chat function and we will address them as long as time permits. As Brenda also mentioned, there will be an email address posted at the very end of the presentation. So if you think of something after the fact, please jot it down and feel free to reach out to us. So it is now my pleasure to kick it off to Dan and Dr. Cohen.
Thank you. Awesome. Thank you, Kate. Thank you, everyone, for joining. I mean, the turnout is incredible. I keep seeing people joining and joining. So this is wonderful. And we're really grateful to Brenda for reaching out and asking us to be part of this and to offer our experience thus far with COVID and the COVID vaccination. And we know that your questions are really the important part here. We do have a presentation that we're going to try to keep brief so that we give you all the opportunity to really ask us the questions that are burning for you. So with that, we're going to go ahead and just get right into it. So these are the numbers. We have a US population of 331 million people. The worldwide cases of COVID are right there, 112. And I promise you, we normally do not read slides to you. So these are ones where we just have to simply tell you what it is, but the whole presentation won't be like this. Worldwide deaths, 2 million. We can all say that that's 2 million too many. COVID cases, 28 million in the US. US COVID deaths, 503,000. New York State COVID cases, 1 million. New York State COVID deaths, 47,000. Orange County cases, 35,000, and Orange County deaths, 720. Now, I can tell you that we pulled this morning. I will guarantee you that all of these numbers have since changed. And so part of this is, the caveat to this entire presentation is what we're presenting to you today will be different tomorrow. Many of the concepts that you'll learn about COVID and those things, those won't necessarily change tomorrow, but they are changing. They're forever changing until we learn more about the disease and especially about the vaccine. But it is what we have. So Evan's going to talk to you about the epidemic and the pandemic.
Thank you, Dan. Thank you, Brenda, and thank you all for joining us tonight. Before we start talking about the vaccine, I think it's important to understand a little bit about the virus and the disease. An epidemic, and just some of the terminology. An epidemic is the rapid spread of a disease through a population in a short time, versus a pandemic, which is an epidemic that spread over a large region of the world, like in Spanish flu, swine flu, or currently with COVID-19. Coronaviruses are very common. They've been around for thousands of years, causing disease in animals and in humans. Most commonly, I think of the common colds can be caused by a coronavirus. This depiction on the bottom right of your screen, you'll see an actual image of a coronavirus, and you kind of understand where it gets its name. Corona can mean crown, and the spikes around the coronavirus particle will look like a crown. On the top picture, we're going to see a computer-generated image of a coronavirus, and this is the one we've all gotten very used to on the news over the past year. The terminology often is interchangeably used, by myself included, but SARS-CoV-2, or severe acute respiratory syndrome coronavirus 2, is the virus that causes the disease COVID-19, coronavirus disease 19, first identified in 2019 in Wuhan, China. And I myself and many people will use those terms interchangeably, but it's important to understand what the differences are. COVID-19 is thought to have originated from animal to human transmission in Wuhan in 2019, and then took off as human to human transmission started occurring. How is it spread? Mostly, it's spread by respiratory droplets from people sneezing or coughing in close proximity to somebody else, and respiratory particles, viral particles, getting into your nose, your mouth, or your eyes. Luckily, some of the other factors that we originally had a lot of fears about spread, such as aerosolization or touching a dirty surface and then touching your nose or mouth, are much less common and likely ways for this virus to spread. Still possible, but do not seem to play as big of a role as we originally had feared. People will tend to be pre-symptomatic, so they'll harbor the virus in their nose for 2 days, 3 days, 4 days, 5 days, up to 14 days, which means they can be incubating and growing viral particles in their nose and not be symptomatic, and they can be spreading the virus, which is more important, and really is one of the major cruxes of why this disease is so difficult to control. You just don't know that you have it until you've had an opportunity to infect many other people. Once people start developing symptoms, we can transmit virus to another person for on average up to 10 days after you develop your symptoms. You can still test positive for around 18 days, but can be months after you recover from your viral illness. And in fact, it can be normal to test positive well after you've recovered from your illness. Not to be alarmed if you continue to test positive. And these transmission factors and the fact that people will transmit only for around 10 days is how we've gotten to some of the guidelines around quarantining that we've gotten to. Most people will have mild symptoms, kind of like a bad cold or the flu, with muscle aches, coughing, loss of taste of or smell, diarrhea, sore throat, vomiting. And about 20% of people will have severe or critical illness. That's largely driven by risk factors, age, medical conditions, but unfortunately there's some seemingly randomness to this where people with low risk factors or low prediction of severe disease can become very sick.
So testing. Testing has, obviously it's been in the media since the beginning of the virus. And there's a lot of things to understand about the different types of tests that are out there. And there's a lot of misunderstanding and misinformation, quite frankly. So I'm going to try to break these down for you. I'm going to work from what's my left, maybe your right, depending on how we're looking at this screen. But the first test that you see up there where the woman is having a swab inserted into the nose, that's called a PCR test. And that, in order for it to be a PCR test, that swab has to go up and it feels like it's tickling your brain. That's the way you know it's right. If you end up tearing and coughing, someone did it appropriately. That's our typical PCR test. Now, a lot of people think that that's not a rapid test. It actually, in fact, is. In fact, most of these tests, once it's in the lab's hand, the turnaround time for them is under an hour. The problem is that when you're batching these up and you're receiving hundreds of thousands at a time, the reason it takes sometimes 24, 48, 72 hours for the labs to turn them around, they don't so much feel rapid. They feel certainly much less than that. But the PCR is sort of the gold standard test. That's the one that we're going to use to ensure and to confirm that you actually have COVID virus. So the next test that's underneath it, that's going to be what we call an antigen test. This one, you'll probably notice that if you ever go to your doctor's office or if you go to a clinic that's doing antigen tests, this time they're going to use a swab, but they're not going to insert it all the way up. They're usually just going to do circular around the inner nose on both sides. They're going to take it out. They're going to add a little additive to it. They're going to put that Q-tip directly in the top of what you can't see it there, but essentially where they're adding that solution to. And they're going to wait 15 minutes, and that's going to give a result. So it's not that the antigen tests aren't good. They are good, but they are really meant for people who are actually feeling symptoms already. Antigen tests for somebody who is completely negative, asymptomatic, it's not the gold standard. It's not the best test for folks to have. And then the last test that you'll have is an antibody test. This is where we're trying to see whether or not you've had exposure to the disease. And if so, it will show positive, meaning that your body has reacted to it and built antibodies against the virus. And so we look to see whether or not you have those antibodies. This was huge in the beginning of where we were. It's not so much where the focus is today. The focus today is really, if someone needs a test, we get them a test, the gold standard being the PCR test. And then truly once vaccine comes into play, this all kind of changes a little bit. And we'll go into that when we get to the vaccine.
Most people with mild illness are going to be able to do supportive treatment. And that's the same treatment you'd give yourself or a family member if they had a cold or the flu and it was mild. And that involves using medicine to reduce fever if you need to, or body aches. Keeping yourself well hydrated, well nourished, and getting adequate rest. That's supportive treatment, and that's what most people need and will recover well with. When people have more serious or severe illness, or they have higher risk to progress to more serious illness because of their medical conditions or age or other factors, we use more aggressive treatments. I break them down into the different phases of viral illness. In the viral phase, where the virus is replicating rapidly, you want to try to prevent the virus from replicating. So we use medicines like monoclonal antibodies, convalescent plasma, or antiviral medicines like remdesivir. In later phases of COVID-19, where the inflammation in your body is more of a serious factor, we use medicines to reduce inflammation, like steroids or tocilizumab, to modulate your immune system or your immune reaction. And then when people are sick or in the hospital or have risk factors for developing blood clots, we use blood thinners. There is a small percentage of patients that will develop a bacterial infection on top of a viral infection. So they have a pneumonia that's not just from the virus, it's from a bacteria as well. Then we're using antibiotics. Recently, vitamin D has shown some promising impact on disease progression. And this is not an endorsement to go take a bottle of vitamin D. It's important to be in conjunction with your doctor and your vitamin D levels. But vitamin D has shown some promise. And there are many, many other drugs that are being studied and reviewed actively now.
So how can you protect yourself? I don't know where you're living if you don't know most of this already, right? Because everyone knows you really can't be outside or in any public space without a mask. You really should have a 6-foot distance between the people that you are interacting with. Washing your hands, single most important thing that you can do to prevent transmission back and forth from person to person, as well as hand sanitizer. Hand sanitizer got a bad rap a while back. However, with COVID especially, hand sanitizer is not a bad thing. It's actually a very good thing. So all of those things are going to absolutely help to mitigate the spread of the COVID virus. And we encourage that a great deal. So you might see where we're sitting and go, well, you guys don't have masks on at the moment. So I promise you, the way this room is set up is that we have actually greater than 6 feet between each other. It just doesn't look it on this video. And I said, people are going to think that we're sitting right on top of each other. But I promise you we're not, and we have the requisite distance away from one another to be presenting to you without a mask on, and you wouldn't know who we were. And then just to say it, obviously getting vaccinated, that is going to be such a huge part of it. And I'm going to address the elephant in the room, which is, well, great, give me some vaccine, and that'd be a wonderful thing. I understand that vaccine is limited. I understand that, and I'll go through with you shortly some of the numbers on vaccine and where it's available and where it isn't and how it's been dispersed. But the good news, and it's really good news, is that vaccine production has increased, and we will see more of it, and we will see more of it right here in Orange County. Some as soon as this week, definitely next week, and certainly by the end of March. But we'll go through some of that. So just looking at vaccine statistics for a moment, worldwide COVID vaccinations were up to 212 million. United States, we're at 134 million of those 212. New York State accounts for 2.4 million of those. Orange County, 31,000. So I know what you're thinking. Well, of course, there's, why are our numbers up? Why are we still in the yellow zone? All of those things are attributable to that, as well as the fact that there are times where people congregate without doing all of the protective measures that you need to do to prevent the spread. So at this point, we have 12% of the county vaccinated with at least the first dose and 7% with the second dose. And I can tell you I'm very proud of this, as is Evan, that we vaccinated so far over 5,000 folks. And we will continue to do it for as much vaccine as we continue to get, as well as we will assist the county in their pods, and we will assist the state as they request us to assist them in their pods. The companies that have produced vaccine, Moderna, Pfizer, which is the two that are out on the market now, and as Dr. Cohen went through, those are mRNA vaccines, which means that they're not made with any portion of the virus at all. And those are the two who received emergency use authorization. And so what that meant is that they went through the rigorous process of research, and they had, I believe it was just under 80,000 people in the research studies, and proved to be between 95 and 94% effective, depending on which one it was, and at preventing and/or in the transmission of the virus. These vaccines are not easy to store. They have to be stored at -20 to 6 degrees Celsius. And the Pfizer one in particular has to be stored at a -70. And we do here at St. Luke's have this special freezer that's required for that Pfizer vaccine. And very glad we have it, because we hope that they'll produce more, as we understand they are. And that means that we'll have more available to the community. The other vaccines that you see there are all in production. With the last one there, Johnson & Johnson, that one is the one that has already been administered in other countries. And we expect to see their emergency use authorization in the United States somewhere around the end of this week to maybe the beginning of next week. And when that happens, they are poised to have about 20 million doses that are ready to be shipped. And at least 4 million of those doses we know are coming to the US. And so you look at the effectiveness of that vaccine, and as you can see there, it says 66% effective. And so that means that it was 66% effective at preventing transmission and at preventing COVID disease in and of itself. So when you think about that and you look at it with respect to the 95% that Moderna and Pfizer has, you'd say, well, then I don't want that one. I want only Moderna or only Pfizer. But when we put it in perspective of vaccine coverage and you think about the flu vaccine, that vaccine only has about 40%, between 40 and 50% of an effective efficacy. And so, you know, I urge people not to get caught up on the effectiveness of what the vaccine is going to be, because as we get into the larger numbers of people getting vaccinated, I can guarantee, and I don't say that loosely, that number of effectiveness will go up. They need more people in that study in order to make that the reality. I'll turn it over to Evan.
You know, and I would just add onto that last point that it may be only 66% effective at preventing disease, but we suspect it's going to be dramatically more effective at preventing critical disease, hospitalizations, and death, which is, you know, I think as important as anything in allowing us to get back to what we once considered normal life.
That's such a good point. Maybe just you know, because the COVID vaccine themselves, the Pfizer and the Moderna, those are proving to be 100% effective in preventing critical disease and very effective in preventing hospitalizations related to COVID disease. And so that is actually the reason that we want these vaccines on the market.
Which brings us nicely into herd immunity and why are these vaccines so important? And it's hard to talk about the importance of vaccine without just having a little understanding of herd immunity and what it is. On the top picture, we're going to see the purple person who has COVID-19, and the blue people are unvaccinated. This purple person, as we go to the right, has a lot of opportunity to spread that COVID-19 throughout the community. But on the bottom picture, that purple person is surrounded by protected, vaccinated, immune people, and there's not a lot of room. There's that herd immunity. There's not much room for that virus to spread to the vulnerable people. When we have the more contagious a disease is, like we take measles, for example, you really need to get close to 100% of your population vaccinated or immunized to create herd immunity. In a disease that's not very contagious, you know, meningitis, influenza, you need lower numbers of vaccination to get to that herd immunity. And as COVID-19 is quite contagious, not as much as measles, you know, we are aiming for somewhere in that 80%, 70, 85% of our population needs to be immunized either by infection or vaccine to create that herd immunity. So as Dan mentioned, there's really two different platforms for vaccine on the market now, or shortly. The first one is Pfizer and Moderna, and they use an mRNA platform. What that means is they develop an mRNA protein. That mRNA is going to code for a spike protein. So it gets injected into your body. Your body uses that code and creates its own spike protein. Your body then recognizes that spike protein as foreign and develops antibodies. After that, the spike protein is gone. The original mRNA that got injected into you is gone. And all that's left at the end of the day is the antibody and the cellular memory that's going to remember the next time it sees something that looks like that. There's no involvement of your DNA. It doesn't stay with you. It's just gone and you have the memory of it. The next platform is called the viral vector-based, and that's what Johnson & Johnson is using. In Johnson & Johnson's case, they are using an adenovirus, which is a virus that causes the common cold. They make that virus inert, so it is not going to replicate or cause you to get sick. And they put a gene for the spike protein into it. Your body incorporates that into both DNA and mRNA and creates spike protein. And then the same thing happens. Your body recognizes that spike protein as foreign, creates antibodies, and then everything else is gone. And all that's left is the memory of that spike protein. So the next time your body sees something that looks like that, it can attack it rapidly. There's a lot of discussion, in the news and in our, community about the new mutations. And it's important to realize that every virus has mutations. It's basically random errors that the virus is making when it's replicating. And through natural selection, the ones that help that virus replicate or be stronger or more durable are going to survive, and the ones that don't will not survive. And so the more virus that's circulating in the world at a given moment is more opportunity for random errors and mutations to occur. And actually, coronavirus, compared to many other viruses, has relatively lower rates of mutation, which is good. But as we talk about this, we'll understand just one more reason, if we didn't have enough, to the importance of getting immunity and reducing the opportunities that this virus has to make more mutations. So the three that we are thinking about and talking about the most are the South African, the Brazilian, and United Kingdom variants, and those are named based on where they were discovered. We know they seem to spread more quickly and more easily. That doesn't mean they're not susceptible to the things that we've come up with, like mask wearing, hand washing, social distancing, avoiding large crowds. In fact, they're still extremely vulnerable to those defense mechanisms, but they are more likely to cause illness or spread if they have the opportunity to. So let's not give them the opportunity. The other positive, encouraging thing is that so far it looks like the vaccinations are still going to protect people at least from getting seriously ill, hospitalized, or dying from COVID-19. So let's still keep going with our vaccination efforts. And what we don't know yet, but we will, is what's the actual prevalence in our community and our nation with these variants? How are our therapies going to react to these variants? And we'll be learning more over the coming months about these issues.
So what can you expect after you've had the COVID vaccine? And, common side effects are going to be the pain and swelling. So pain typically at the injection site, but we also have noted that people have pain down the arm. It's a completely normal variant of having the vaccine. In fact, many people after a flu shot will experience the exact same type of symptoms, but those are things that we do see. What else can you expect throughout your body? You can expect fever, chills, tiredness, headache. Those are all common side effects. And quite frankly, I hate the fact that we call them side effects. We have to call them side effects, but this is really your body doing its job. Your body is supposed to respond to the fact that it just received the vaccine and the fact that it's mounting that response that Dr. Cohen just spoke about. It's telling your body, hey, the next time you see this, this is what I need you to do. And it's going to go out and it's going to do that. So people will get that. Not everybody will experience these side effects. We do find that the ones on the left, the most common ones, the pain, site tenderness, and the pain in the arm, those are pretty common. Most, I think I would probably say that most of the people, at least the ones that we've spoken to and have come back for their second dose, have said that is something that they experience. But they said that's a whole lot better than having COVID and or being hospitalized and or obviously worse outcomes. And then I can't even tell you that it's half, because it's not even half. But some others do experience some of the other ones. And I know that we've gotten questions, and some of those are going to be related to, do you use Tylenol or Motrin or any of those over-the-counter medications to address that? And we're going to talk about when and why to use those versus when never to use those. But the helpful sort of tips that are up here are when you do have site tenderness, to use a cool cloth over the area, to actually move your arm, despite the fact that it may hurt to move it. It's actually a very good thing to move it and keep the blood circulating in that arm versus nursing it and not moving it around. Always, always, always drinking lots of fluid, which helps to just flush your body out. And obviously, if you're feeling feverish, you should not have, tons of clothes on and tons of blankets like in the old days. They tell you to sweat it out. That's not what we want you to do. And we'll talk more about that as we go through it. Obviously, if these cases you feel worse than that, we do ask you to give your physician a call, and most often your physician will probably direct you at that point, because those symptoms have become so intolerable to you, to more than likely use something like an Advil, an ibuprofen, Tylenol, Motrin. But that's only because you've gotten to a point where the symptoms are simply intolerable to you. But as we'll talk about, vaccine experts, immunologists, virologists would tell you that let your body do the normal thing. This too shall pass. You probably will experience those for anywhere from 8 to 48 hours. And as quickly as they come, they will quickly go away as well. So to whatever degree you can tolerate it, it allows your body to mount that response. To the right there, you see that little hand holding something called a V-Safe. So when you get your vaccination, someone is going to ask you to go ahead and go out to this website. It's a little app. You can scan one of those QR codes. It brings up the V-Safe, and you'll enter your information into there. You'll have your information about the type of vaccine you got, and they're going to give you regular updates and ask you regular questions about how you're feeling. Are you having side effects? What are they if you're having them? And then they'll check in more frequently if you tell it that it does. But ultimately, what that's doing is helping us to learn a lot more about the vaccine in terms of what types of side effects folks might be having and how frequently those side effects might be existing. So if you're like me, you want the information and the education. And so these are certainly things that we will make available through Brenda for all of you. And that will be on our website as well if you'd like to link through there. But these are the links in which we grab much of our information that you've seen presented here today. And that's why I said tomorrow when you look at these, or even tonight when you look at these numbers could have changed as a result of it. Very easy to click on those links. It'll take you to those places and you can see it. So we gave you some worldwide links. We gave you New York State links. And of course, we gave you the county link in order to see what the vaccine is, as well as the COVID cases. To the right lower there is something called openwho.org, and that stands for the World Health Organization. And when you click on that, it will take you to all sorts of training and education that are very beneficial. And while a lot of these are geared towards healthcare professionals, there is a lot of education for the public. So we thought that might be something that folks might be interested in. So please feel free to go on out there and do that. So I think we've come to hopefully what has been a good overview of the COVID virus, what happens, the disease, how it's really called, testing, and ultimately vaccination. And as we talked about, and Kate can do this, I know we have some questions, and we're gonna start addressing some of those questions. And Kate is going to be working on the chat room to see if other questions are coming up if we don't get to addressing those. So with that said.
So thank you, Dan. Just a quick reminder, you see the email address on this screen. Please feel free, if you don't feel comfortable utilizing the chat feature, or you think of something after the presentation, jot the email address down. We'd be happy to get back to you after. So
can we just stop the share so that we can see the
absolutely. So our first question is, if someone received both doses of the vaccine for COVID-19, should they be tested if they were exposed to the virus?
It's a really good question, and it's got a lot of complexity to it. The first thing to think about is, how do you define an exposure? As an emergency physician, when I'm on shift, I'm frequently encountering or surrounded by patients with COVID-19 all day long. But I'm wearing a mask and they're wearing a mask, and I have very limited or brief periods where I'm within 6 feet of them. I don't consider that as an exposure that is going to require me to get a test or do quarantine. But that's very different than somebody sneezing. I have a 3-year-old child. If my child sneezes in my face, and she has COVID, that's a real exposure for anyone with little kids. I'm sure that's happened to you multiple times. So, the first point is you really have to define your exposure. The second thing to keep in mind is that when you're vaccinated, it's been shown that the immunity that you develop is at least 10 times stronger than the immunity you're developing from a natural infection from COVID. So that vaccine really gives you a lot of protection. It's also important to kind of understand the CDC guidelines as they are, which does say that if you're 2 weeks post your second vaccine and you're within a 90-day window of that time period, you don't need to quarantine. That will change probably multiple times, that guideline, but that's the guideline as it is right now. So you don't need to per the CDC guidelines, but we also need to think about what's the socially responsible thing to do. And that's going to be so much based on individual factors. Just as an example, if my daughter had COVID and sneezed on my face, and in 2 days I knew I was going to see my elderly grandmother who has not received her vaccine, who cares what the CDC says? I know that it's socially responsible for me to get a test and quarantine and probably delay that visit. So it's a nuanced question, but I hope that helps to go through some of the nuances.
Thank you, Dr. Cohen. Our next question is, although I am now a full-time resident of New Hampshire, I have opted to keep my endocrinologist in Newburgh via virtual appointments. Once I receive my vaccine, I would like to travel to Newburgh for an in-person visit. Will I have to quarantine on arrival, and for how long?
So there's a ton of websites that you can go out to, some of the ones that you're linked to, that will link to all of the different travel restrictions that are in existence today. But if this person in the way that they write this, there is no reason that they can not travel and have this appointment. And right now that travel restriction would not require quarantine for a few reasons. One, it sounds like you're going to be in the area for less than 24 hours. And so as such, that does not require quarantine when you're just simply passing through. If you're going to be in the area for greater than 24 hours, it will honestly depend on where it's at that time. And that's why you have to always search the websites. And New York State's website, the one that we linked you to here, if you just click on the travel restrictions, it'll tell you what the current travel restrictions are based upon where you're coming from and exactly what it is that you plan to do here and how long you're staying. So hopefully that helps to answer that question.
Thanks, Dan. Our next question is, if I have a shellfish allergy and I'm concerned about taking the vaccine, both of my doctors say I'm okay and should go for it. Does one vaccine have a higher chance of causing an allergic reaction than the other? And should I take Benadryl or allergy medication before the shot? Is it possible to get the shot in a medical facility? Or I'm sorry, is it better to receive the shot in a medical facility in case of a reaction, or a local pharmacy is okay?
So to try to break that down a little bit, yes, you should get the shot. And as somebody who has a shellfish allergy or a severe allergy to anything, you should be having an epinephrine pen with you at all times as you go through life. And if you have not, that should be something you should speak with your doctor about. Anybody with an allergic reaction to anything, whether it's peanuts, bees, shellfish pollen, etc., will have a higher risk to have an allergic reaction to any new substance, whether that's a new food, a new medication, or a COVID vaccine. So it is recognized that that will increase your risk somewhat. And as a result, when you do get the COVID vaccine, you will be monitored for 30 minutes instead of 15 minutes. And that's based on the Pfizer and Moderna studies showing that the very, very few people that did have reactions were almost all within that time period. And that's where that monitoring length of time is coming from. I would not recommend pre-medicating yourself with Benadryl or other medications before the vaccine. And I think that, any vaccine approved site is going to be okay because they will have a medical personnel on staff. You will have your epinephrine pen and you will be monitored.
Thank you. Our next question is it true that we need to wait 90 days after testing positive before being vaccinated?
That's a great question. And I'm going to make an assumption that you mean if you were COVID positive, do you need to wait 90 days after your COVID positiveness in order to get vaccinated? And the answer to that question is it's a couple of answers. One is no, you don't. But it's going to depend on what's actually happened. So the first thing is, if you were hospitalized as a result of your COVID and you received certain types of medications, which would be questioned when you were looking to receive the COVID vaccine, then yes, you might be asked to wait the 90-day period, not because we don't want to give it to you, but because there are reasons for us not wanting to give it to you based on the types of medications that you would have gotten are still new medications, and we still need to be looking at how those are helping you to progress through disease, especially if you require those to assist you. The second thing is that there's a 14-day waiting period when you have had another vaccine. So for instance, many people come due for their shingles vaccine, and they will have it a day or 3 days before their scheduled time or when they get selected to come for a COVID vaccine. Well, we don't like to give one vaccine on top of another. We like to have 14 days. The reason is because we would never be able to tell whether or not you were having a reaction or side effects related to one vaccine versus the other. So that 14-day period is actually set up for that reason. If you're a person who's just had COVID and you're 10 days after having COVID, you have completely no symptoms, you're not using any fever-reducing medicines or the like, then you can absolutely receive the vaccine at that point, especially if you're being offered it. The whole reason that it got put out about 90 days is that what we were talking about with respect to immunity. There is some natural immunity that is given as a result of having acquired COVID. And so because of that natural immunity, you will have more coverage than someone who has not had COVID and who is going to ultimately be able to get the vaccine before you. And so it would make sense that they're just simply asking you to wait for that reason. But just to be clear, you're not precluded from having the vaccine unless you fall into one of those other categories, as long as you're at least 10 days post and you don't have any symptoms and you're not using any medications like Tylenol or Advil to reduce a fever or treat the quote unquote pain or body aches that come along with some of the COVID symptoms.
Thank you.
Hopefully that makes sense. Yeah. All right.
So approximately 8 days after receiving the first Moderna COVID vaccine, I developed a symptom commonly called COVID arm. Please discuss the symptom, what causes it, treatment, and am I likely to have it following my second dose?
Sure. So this is something that's caused by a hypersensitivity. So your body is reacting to a foreign substance on a local level. We do see that with other injections, both vaccinations and medications. And it's very different than having an anaphylactic reaction, which is your entire body systemically rejecting this medication. This is, I would consider, on the spectrum of a normal reaction to a foreign substance being injected into your arm. It's not dangerous, it will go away. When does it go away? Some people it's 3 days, some people it's 13 days, but they will go away. And will you get it on your second shot? It's certainly possible, and it shouldn't preclude you from going ahead and getting that second shot.
And we just alternate the arm. If you had it in the left, we ask that you do it in the right the next time. And make no mistake about it, if you do develop COVID arm, it's almost softball size. And you look at it and you go, oh my gosh, like, why would I have this? But it is seen in other hypersensitivity reactions, even in latex allergies and stuff. We can see very similar things that happen, and you get this firmness, redness, hotness that almost feels like infection in any other situation, but that's not what this is. And in every case, and by the way, we've only seen 1 in the 5,000 injections that we've given, but it's not that it's not more common than that. It's just that simply our community does not seem to be developing COVID arm at the rate of maybe other communities, I don't know. But it's definitely something not to worry about, but we're not trying to minimize the fact that if you're the person with it, it certainly seems like a lot to worry about, but really it's a normal side effect to what we're seeing.
Okay.
Does that make sense?
So our next question, and I apologize if you read quickly, I just want to be mindful of everyone's time as we approach the hour. So I have read that products such as aspirin, Tylenol, et cetera, should not be taken at the time of vaccination. How long after receiving my vaccination is it okay to take such products for relief of symptoms like discomfort caused by the above or other possible side effects?
So I'm gonna make this one really quick because we kind of talked about it already, and that is that many of you probably remember or still have children, and your doctor would tell you before you come to the office, give the child Tylenol or Motrin prior to their vaccine. Well, that's not what you do here. In this situation, we do not want you to take anything prophylactically or prior to the vaccine. You should come, have your vaccine, and then let your body mount its response. Only if you get intolerable side effects, meaning that the body aches or a fever are too much for you to handle, then and only then should you contact your doctor and or use the normal over-the-counter medicines that you take, such as Tylenol or Motrin or Advil, to treat your fever and body aches. But you should not do it under any other circumstances as it relates to the COVID vaccine. And as I said, virologists, immunologists, allergists, the medical community at large, the CDC all recommends that you not do that, until you've developed symptoms that ultimately become intolerable to you. Because again, it's your body doing the right thing. While it may feel uncomfortable, if you can get through that uncomfortableness without doing it, it's the best thing you can do for your body.
Our next question is, are the doses of the vaccine exactly the same in terms of components, such as strength, volume, et cetera, for both dose number 1 and number 2? In other words, would it make a difference if someone mistakenly received their first dose injection as what would have been their second dose?
So that's a quick one. It does not make a difference. It's the same dose formulation. There's nothing special. It's a logistical issue to potentially label something a first dose or second issue. It's not a clinical issue, so it does not matter.
Is one more likely to become ill from side effects after the Pfizer vaccine versus the Moderna vaccine? And are younger individuals are more likely to become ill than older? And if so, why?
So there's really no data on whether or not young or old become sicker or have more side effects. There's just not that data is not there. I can tell you, and I'll say this anecdotally, as well as I think what I've seen in the literature, is that more people will have more common side effects from Moderna than they do Pfizer. There tends to be less side effects or any effects felt by the Pfizer vaccine. However, I'm just going to tell you that I've had people with, what they would consider severe side effects to them, which are common side effects to us, from Pfizer vaccine, just as I've had them from Moderna. But definitely Moderna seems to have more of the side effects, or more people certainly experience them. Not to the point where they need to do anything about them, just that they're reporting that they have them.
Okay, and this next one you touched on briefly in the presentation, but what is the percentage of protection that one gains from the different vaccines that are out there, and over what time frames? I've heard that there is some protection 2 weeks after the first dose. Can you differentiate the percentages for each vaccine along with the time frame for protection?
Sure. So yeah, we did touch on this, but it's just so important, and to me, it's so incredible that here we are talking about these numbers. So again, Pfizer and Moderna. We're looking at a reduction of COVID disease, somewhere 94–95%, and a reduction of hospitalization and death from COVID. I believe it's 100% if you can make it 2 weeks post your second shot. It's mind-blowing to me, and I think it's incredible. Again, just comparing that to something like the flu vaccine of 40–50%. But to reach these numbers with the safety profile these vaccines have is, to me, nothing short of a miracle. again, it's not instantaneous. Your body needs a little bit of time to ramp up that immune response. Don't get that second shot and go to the club. You got to wait a couple weeks and then probably still don't go to the club. But once you make it to that 2-week point, you really can have some assurance that you're going to be okay from COVID.
You can tell Dr. Cohen is young. He's talking about going to the club. I'm not so sure. I've been to the club in a long time, and I'm not sure what the club is. But I get it. But yeah, I mean, just protecting yourself up to 2 weeks, and then, I know that we've heard questions about, do I need to still wear a mask? Do I still need to do all those things? Yes. We need to do those until we've reached a point where we have herd immunity through natural and vaccinated people. We still need to do all of those things.
Okay, so our next one was definitely covered in the presentation as far as what do we know about the usefulness of the vaccines in terms of fighting the new variants of COVID?
They're effective. So let's go to the next.
Yeah, so is there a window in which to receive the second vaccine if weather or delivery events occur and the second date is later? Does it make a difference as to which brand you received for that?
Sure. So I'll tell you, the guidance on this is that when we tell you it's 21 days for Pfizer and 28 days for Moderna, we truly mean 21 and 28 days. And we mean that for a number of different reasons. First of all the studies were done based upon 21 and 28 days second dose follow-ups. So it's vitally important that you show up for the vaccine on the 21st or 28th day for your second dose. Secondly, the vaccine supply, as everyone knows, is in very short supply. So when we take a dose out of a vial, we're actually taking, let's just say I have 5 people in line and I'm about to give the dose to each person, and someone doesn't show up. Well, that next dose is going to be wasted. And if that's the end of the day, I've just completely wasted a dose because you couldn't come for your second dose for the plethora of reasons and good excuses that people have for not coming for their second dose. So we do everything possible to make sure that that doesn't occur. And there are reasons not to come for your second dose, but I'm not even going to go through it because you'll know and you'll call us and we'll walk you through that process, or you'll call whoever it is that gave you your first dose to let them know. But let's just say that weather, because that was part of the question, weather got in the way, and now we do have to cancel, and that actually recently happened. So the guidance is that we get you that vaccine as close to either the 21st or 28th day as we possibly can after it was originally due. And so for us, that happened recently with the snow. We did that the very next day. And people called us and said, I'm sorry, I had taken my day off of work, I had done all this. That's okay, I get it. But here's the thing. We still have to give all that vaccine to the people who do show up, which is ultimately not going to leave any doses left for your vaccine. And then we have to send you to what's called the vaccine hub. We send your name to the hub, and they have to find a place that's going to ultimately have a dose for you at some point in time. I can tell you on a recent experience that we had here at the hospital, we had people who lived together. All of them were put on quarantine for 14 days after the dose. And those 3 people living in that household, we could not find another dose of vaccine for them for almost 20 days after their dates were due. The manufacturers of the vaccine, as well as the CDC, have guided that said, you'll be okay, it'll do it. But the guidance truly is to do it as close, if you can't do it on the day of, to do it as close. But I will urge you, because we've had a number of these situations, I will urge you to always show up on either the 21st or 28th day. You don't want to mess around with that, and you don't want to end up at some mass vaccination site trying to figure out whether or not you're going to get it because someone's put you on a standby list. It's just not the way to do it. So for those who haven't been vaccinated, who will be vaccinated, I just encourage you to think about it from that perspective.
If someone had COVID previously, do they need antibody testing before receiving the vaccine?
No, they don't need antibody testing. They don't need a COVID test. That's not how the studies were done. They were given without that knowledge. And no, they would not need those testing before getting the vaccine.
Yeah, in fact, we've given vaccine to people who at the time were completely asymptomatic, didn't know they had COVID, and then ultimately tested positive for COVID because someone in their home tested positive. They had to put themselves on quarantine. And we were ultimately able to give them their dose at the right interval because they had gone through their 10-day period, post their test, and there was no problems with it. Because asymptomatic is asymptomatic. It means that, yes, you had an exposure, but you don't have an issue getting the vaccine.
Should I reschedule a mammogram due to the potential for swollen lymph nodes from the vaccine?
I think if you have a mammogram scheduled already, I would not advise rescheduling it. I do think it's valuable and worthwhile to mention to the mammographer or radiologist that you just had a COVID vaccine. And certainly if you notice that you have swollen lymph nodes, to let the radiologist know, I had a COVID vaccine and this lymph node is swollen, so the radiologist doesn't get confused with that lymph node being something else.
And that's primarily because with both vaccines, some people do develop what's called lymphadenopathy. It's a normal response in your body where you'll get a lymph node underneath your arm. Some people get a large one, some people get small ones, and actually you wouldn't even know it until after you've had your mammogram and it shows up, and then they find out that you were on the vaccine. So to Dr. Cohen's point, you wouldn't not do it unless you noticed that it was there, and then reach out to your doc and see whether or not they want you to postpone your mammogram, because you might be doing your mammogram for a very good reason, not just simply because it's your annual, but because you have a reason to be doing it now. And we don't want you to overlook that.
Thank you. And we did receive just a couple of questions via the chat, which we'll go through quickly in interest of time. So most examples of comorbidities discuss if a person has only one. What if a person has more than one comorbidity? How might the vaccine affect that individual? And is there any data available on that?
Any comorbidity, you should be getting vaccinated, right?
The more
you have, the more you should do it.
Right.
Once you're vaccinated, will you test positive? Which I think you just answered.
No, you will not test positive from the vaccine, regardless of what the vaccine is. You'll never test positive. I don't care what the vaccine is. You will never test positive because of the vaccine. You will only test positive because you have had the virus itself, but you'll never test positive.
Right. The test is testing for viral replication. The vaccine just creates antibodies.
I know I saw one on there about latex allergy,
Yeah.
so I just want to address it. Latex allergy, there are absolutely no contraindications to either of the vaccines that are currently on the market under emergency use authorization. There are no contraindications to any of them. So latex allergy, no, none of that. Obviously, you want to tell us so that we don't use, a latex containing glove or a latex containing product, which, by the way, most places have simply just done away with that, and you're not going to come into contact with latex when you're in a vaccine clinic, especially. But there's nothing. There's really nothing out there other than what's stated in the manufacturer's explanation, and that is that if you are allergic to any of the components of the vaccine, and when you do that, you can go out to the websites that we've given you, and it'll list them all out there. And if you know you have a allergic reaction to any of those, that's the only contraindication to any of the vaccines.
And how long does the immunization last?
So the immunity, I'll tell you in a year or two. Right now we're getting guidance of 90 days regarding the quarantining and post-exposure. But the reason for that is it's only been 90 days. They're not going to change the guidance every day, but they will continue to change it. Now, the one really reassuring thing that I can say is that people that have gotten natural infection, now up to a year we've been dealing with this, it's incredibly rare. It's a lightning strike at this point to have developed COVID a second time. And because your vaccine-induced immunity is 10 times stronger than that, we can guess that you may be protected up to a year or longer, but we don't know. A lot depends on your body's waning immunity, and a lot depends on what mutations we're dealing with in the future. Right now, we just know it's still good.
And more to come with that, because what they're doing is that's where the antibody testing is important. And that's, the study is continuing, and that's what they do, is they test all these participants for, 90, 120. They'll test them all the way out for a couple of years. That's why, people go into these studies. They will continue to test them and look at their antibody levels and look at how much exposure they could have had. And as long as they still remain negative, we've got our fingers crossed here that it's hopefully, 2 and done, depending on the vaccine you get, or a 1 and done. And hopefully we won't have to boost, or if we do, maybe it'll be similar to, tetanus, because you had some sort of exposure, we boost you, or it's 10 years,
Okay, we've got just a couple more questions, which we'll go through super quick, and then anything additional, please email us, and we'll be happy to respond to you directly via email, and we can even share it with all respondents as well.
Oh, that question right there, I see that. Is signing up on the New York State website the only way to get the vaccine? That's a really important question. The pop-ups, the hubs, all of these things that you hear about, if you are not on a list, I will guarantee you this one thing: you will not get vaccinated. So you must be on a list somewhere. I will tell you, if you live in Orange County, you should be on the county list. That list is, they go immediately to that list and they pull off names, and they just keep going. So for whatever date you put yourself on there, they just keep taking your name off of that list. So I would really encourage you to do that. The other website, and if you navigate to montefioreslc.org and you click on our COVID banner, it will take you to these websites. It'll take you to the county site. You can also go out to the county site and just click on the vaccine form, and you'll fill it in and you'll sign up there. The Am I Eligible? I know many people are frustrated by this website. However, I will tell you, it's an effective website. If you go on that website and you click where you are and you go through the motions of doing it, at the end, it's going to show you, based on your zip code, where you can go. And it's going to show you all the way up to Buffalo. And I mean, I've had people call me and say, I got an appointment in Plattsburgh for tomorrow, but I don't want to drive to Plattsburgh. Well, how bad do you want that vaccine? Because if that's where it's available and that's where they're giving it to you, I'm not going to tell you not to do it nor to do it. I'm just going to tell you that that's where it's available. And that's going to keep changing. So you have to go out to that website a lot if you're going to look at where it's going. You've probably heard of these hubs, these pop-ups. I will tell you right now, when you hear of a pop-up, unless you're on somebody's list somewhere, you will not be into a pop-up. A pop-up is done usually for a very specific population. For instance, the 65 and older population, disparate populations, those with comorbid conditions, but that meet very strict criteria on those pieces. And those are run by the Department of Health, the New York State Department of Health. Hospitals, pharmacies, everybody, none of us have anything to do with those. We usually are the ones who help assisting with them, but we will never be the ones who are doing these pop-ups from that perspective. So whoever asked that question, great question. Get yourself on some list somewhere. Lastly on that is just pharmacies. Pharmacies have been given, for the 65 and older population, the right to do it. I will tell you that most, and I can, because it's out there, most of the pharmacies that have been given this are the Walgreens pharmacies. If you have not signed up on the Walgreens Find Care website, you'll not get a vaccine likely in a pharmacy. But the Walgreens were the ones, mostly in New York State, that have gotten them. So I would encourage you to go out to that website as well. And I think we put it, it's walgreenscarefinder.com or something like that.
Yeah.
And I think it's on our website. You can navigate to that as well.
Just two last really quick ones. How soon are antibodies detected following the vaccine?
I like the title there. So, it's interesting. Antibodies may be detected within a few days, but just if your antibody test is negative after the vaccine, it doesn't mean the vaccine didn't work. There's many, many different types of immune cells in your body, and many of them are not detected by the standard antibody test. So The guidance is, and I'll tell you, I didn't go get an antibody test. You got the vaccine, you have about 100% chance of being protected against serious disease from COVID, no matter what that antibody test says, and don't rely on that. And you probably don't need to go do it.
Yeah, I wouldn't do it, and not until you're asked to do it, because they are trying to perfect the antibody testing. The markers, as they call them, that Dr. Cohen was just talking about, those markers are being perfected. They've only been, the markers that they've been using are chimpanzee studies, and they're trying to correlate the chimpanzee studies to the humans as they're taking off those markers to see how effective they're showing. And then the chimpanzee studies, they showed extremely effective. But obviously we want to translate that to human. And that's the good news, right? It's that it is showing to be very effective, but they're not the traditional markers that we would have expected to see. So we have to find those and make sure that that's what they are. So I'd say don't do it, because if you're going to get in your head about that, you're just going to get, you're going to get overly crazy about it.
And our last question of the evening, which you touched on briefly before a little bit, but we were told by our provider that the delay for our second shot due to weather would be okay as long as you receive it within 42 days of the first shot. This was supposedly based on CDC guidance. We have appointments for this Friday for our second, which is 5 to 7 days after our first. This is the problem.
Yeah. 5 to 7 days, not so bad. 42 days, no, none of us want to see you go 42 days. And while that might be the guidance, and actually the guidance, that the most recent guidance that I can tell you we have is that the manufacturers are standing behind the fact that you need the second dose. So regardless of when you get that second dose, you need it. But their advice is that you get that as close to the 21st or 28th day that you get it. So yeah, great. I'm happy that those folks are getting it within 5 to 7 days of when they got it. But it really should be and as close to as possible to that 21st or 28th day. Try not, do your very, very best not to miss it. I think organizations that set it up for that long after, it's sometimes it's just because, they don't have the staff to bring in and get, those folks vaccinated. And so that might have been, part of the issue. Or I will tell you, it got a little hairy there because we had one storm right after another. Hospitals are 24/7, so we always have the staff, we're always here, and we're always going to try to do it. But we also recognize that a lot of people don't want to drive in that kind of weather, and it's not safe. And so we try to do them immediately after.
So that concludes our program for this evening. And again, I ask if you think of any questions, if there was something that we touched on this evening that you need or would like to know more about, email us at education@montefioreslc.org. We'll get back to you as soon as possible. And we really appreciate you all taking the time to join us tonight and learn about the vaccine and its importance. And we hope that you found it useful.
Good. And I would like to also say thank you to our audience participants for supporting the Cornwall Public Library partnership that we've developed with Montefiore St. Luke's Cornwall Hospital. I want to thank you, Dan, President and Chief Operating Officer, Dr. Evan Cohn, Medical Director and Chairman of Emergency Services, for not only your time this evening, but your presence to me and our community clearly shows the importance that you place on the health of our community, that you serve with excellence. You're the leaders of your organization and the leaders of healthcare in Orange County. And the fact that you came and did this shows the importance that you place on our healthcare. For this and all the other services that you render to us. I also want to thank the marketing team, Kate Dabrowski. Thank you very much. I've worked with you before, and this was another home run.
She fell out of the view.
Yeah. A program doesn't just happen with one person doing it. It really takes a team. And with that said, I really want to thank the professionalism and dedication of Kevin Venkatash. He's the marketing coordinator that we've worked with behind the scenes, and he is a pleasure. Thank you, Kevin, for helping to do this and putting it together. So I really want to thank you. It's very, very much appreciated. And lastly, a little Cornwall Library propaganda. We are going to be partnering again with Montefiore St. Luke's Cornwall Hospital on Thursday, March 4th at 6 o'clock with Dr. Ashraf. He's an orthopedic surgeon on a program called Treating Osteoarthritis. And make no bones about it, it'll be a very informative program. So I hope you register for that. We hope to continue partnering with you and continuing doing programs for our community. Thank everyone for coming, and please, everyone, be safe, be healthy. And again, thank you for the time that you took to do this for us and for everyone who attended. Thank you. Be safe,
Brenda,
everyone.
thank you. Thank you for always
Thank you.
doing this. Thank you to the community for showing up for us. We really appreciate it.
Thank you for having us.
Bye, guys.
Thank you. Have a good night, everybody. Home safe.
Bye.
Bye-bye.